back to English Pod. My name is Marco.
And I'm Erica.
And today we're going to be going to one of the least favorite places of many, many people.
So it must be the dentist.
Exactly. That place where you have to go every 6 months, but
you probably don't go.
You probably don't. I know I don't go every 6 months. So yeah, we're going to be going to the dentist. And of course, we're going to be looking at a lot of great vocabulary related to teeth and all that crazy stuff dentists do.
Yes, and we'll also learn some really interesting phrases. So Marco, let's get started with our vocabulary preview.
Vocabulary preview.
Okay, in vocabulary preview today we have 2 words. Let's take a look at the first one. Toothache.
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 Okay, so we've seen before this this ending ache, right?
Right.
It means it hurts.
Exactly.
So again, a toothache would be
a hurting tooth.
A hurting tooth.
Yes.
We can also say stomach ache, headache.
Yep.
Pretty much everything can
ache.
Ache.
Yeah.
Okay.
So our next word, X-ray.
X-ray.
X-ray. X-ray.
Okay, pretty easy word. So when you go to the doctor, many times you'll get an X-ray.
It is a picture of your bones.
Right. So that's an X-ray.
All right, well, we're going to hear both of these words in the dialogue. So why don't we listen as Gary visits his dentist?
Hey, Gary. Great to see you again. Please, have a seat. So, tell me what seems to be the problem.
Thanks, Doc. I've got a really bad toothache. I can't eat anything, and look, my face is all swollen. I think it might be my wisdom teeth.
Well, let's have a look. Open wide. This doesn't look good. Well, it looks like you have a cavity and your crown is loose. We'll need to put in a filling before it gets any worse. And the crown probably needs to be refitted. I'm going to order some x-rays.
Is it gonna hurt?
No, not at all. Just lay back and relax. Okay, spit.
Okay, that always happens. The dentist says, no, it's not going to hurt. Don't worry about it.
But it always hurts much more than he says.
Exactly. So in this dialogue, we saw some interesting words when the dentist was describing what problems Gary had.
Yes. So why don't we look at those now in language takeaway?
Language takeaway.
All right, let's take a look at our first word.
So Gary said that his face was all swollen.
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 So swollen is an adjective, right, Marco?
Right. So his face is or was swollen.
It was bigger.
Yeah, his face was bigger than normal.
Yes. Often when you hurt yourself, that part of your body becomes swollen.
Swollen, right. So you have to put some ice on it usually, and then the swelling will go down.
And that's the noun, the swelling.
Right. The swelling. And, well, the verb to swell.
All right, 3 words for the price of 1.
So let's listen to some examples of how we would use the swelling, swollen, and to swell.
Example 1.
My nose is swollen. It's the size of a football.
Example 2. Put some ice on your foot and the swelling will go down. Example 3.
I got bitten by a spider and my hand is swelling up.
All right, so Gary's face was swollen and he thought that it was his wisdom teeth.
Wisdom teeth.
Wisdom teeth.
Okay, so this is interesting. Wisdom is like wise.
Yeah, knowledge.
Knowledge.
Yeah.
So these teeth, they're not knowledgeable, but they're called wisdom teeth.
They're the teeth that grow last in your mouth, right?
Right. They are the last teeth at the very end of your mouth.
Yes, and usually you get them when you're about 20.
And since they come out at this age, sometimes they interfere or they hurt a little bit, so you have to get them taken out.
Yes. All right, wisdom teeth.
Wisdom teeth. Okay, now for our next word and something that we all got as children. Cavity.
Cavity.
A cavity.
A cavity. It's a hole in your tooth.
A hole in your tooth. And it's caused by
Too much sugar.
too much sugar, right?
Yeah.
Or not brushing your teeth enough.
Yeah.
So that's why everyone had it, I think, as children. Cavities.
I never had a cavity.
Really?
Yeah.
Wow. Didn't have much sugar?
I guess I was a bit of a health nut when I was a kid. Well,
okay.
no, I wasn't. My mom was. No, I guess not. All right. But enough about my eating habits. Let's talk about our next word, crown.
Crown.
A crown.
So a crown. This is interesting.
We're not talking kings and queens.
Right. That's the first thing that comes to mind, right?
Yeah.
No, a crown is actually the visible part of your teeth.
Okay, so there's one part of your tooth that's inside that you can't see, right?
That's called the root.
Yes. So when he said your crown is loose, was he talking really about the actual tooth?
So sometimes people will lose a tooth or have a really bad cavity. So the dentist needs to make a new crown or a new visible part of the tooth for you. So sometimes it'll be made of gold.
Yep.
You know?
Or porcelain.
Porcelain.
Yeah.
Exactly.
So a crown, it's like a really, really, really big filling.
A crown. So his crown needed to be refitted or put back into place.
Yes. Now our final word, a filling.
Filling.
A filling.
A filling.
So I just said this word previously. Now, when you have a cavity, you need to fill it in.
Right. You need to fill it with something.
Yes.
It's usually some sort of paste.
And it gets really hard,
And
just like your tooth.
Exactly. So then it covers up this cavity. Filling.
A filling.
I have many fillings. I wasn't very healthy as a kid.
All right, not a good toothbrusher.
Exactly. So why don't we listen to this dialogue again, and then we'll come back and talk a little bit about some of the interesting phrases that the doctor used.
Hey, Gary. Great to see you again. Please have a seat. So, tell me what seems to be the problem.
Thanks, Doc. I've got a really bad toothache. I can't eat anything, and look, my face is all swollen. I think it might be my wisdom teeth.
Well, let's have a look. Open wide. This doesn't look good. Well, it looks like you have a cavity and your crown is loose. We'll need to put in a filling before it gets any worse. And the crown probably needs to be refitted. I'm going to order some x-rays.
Is it gonna hurt?
No, not at all. Just lay back and relax. Okay, spit.
Well, the dentist used 3 really interesting phrases, and I want to look at the first one. What seems to be the problem?
What seems to be the problem?
What seems to be the problem?
Okay. Very easy little sentence to ask somebody what's wrong.
Exactly.
Right.
And I mean, these are small, easy words, but when you put them together, they sound really natural and really fluent.
So if you ask somebody what seems to be the problem, it's very polite.
Yep.
And it's a very good way of asking what's wrong.
Yes.
All right.
Our next phrase, also made up of simple words. Let's have a look.
Let's have a look.
Let's have a look.
So this is a phrase that maybe your mechanic or your dentist or your doctor will say.
Or anyone.
Right. Let's
Yeah.
have a look.
Let's look at it and see what the problem is.
Okay. Let's have a look.
Okay, and our final phrase. It doesn't look good.
It doesn't look good.
It doesn't look good.
So I can use this phrase for an object, right?
Yeah.
Like, this house doesn't look good.
Yes, but here it's used a little bit differently. So why don't we listen to some examples to help us understand the meaning?
Example 1. John told me it doesn't look good for me. I probably won't get the job. Example 2.
It doesn't look good for Michael Jackson. He's in a lot of debt.
Example 3. You know, the economy doesn't look very good.
Okay, so in the examples, we can see that they are using it for the situation.
Yeah.
It looks maybe problematic.
Yeah. So when you say it doesn't look good, you basically mean there are going to be problems.
All right. It doesn't look good.
Yep.
Okay. So great phrases, great words. Let's listen to our Gary at the dentist one more time, and then we'll come back and talk a little bit more.
Hey, Gary. Great to see you again. Please, have a seat. So, tell me what seems to be the problem.
Thanks, Doc. I've got a really bad toothache. I can't eat anything, and look, my face is all swollen. I think it might be my wisdom teeth.
Well, let's have a look. Open wide. This doesn't look good. Well, it looks like you have a cavity and your crown is loose. We'll need to put in a filling before it gets any worse. And the crown probably needs to be refitted. I'm going to order some x-rays.
Is it gonna hurt?
No, not at all. Just lay back and relax. Okay, spit.
Well, Marco, speaking of dentists, have you ever had an experience like this where you spat out a tooth at the dentist?
Well, nothing so serious as this, but actually, recently when I was in Cambodia...
Oh, right, you called us from Cambodia.
Yeah. Well, our taxi driver offered us to have some local food. And he said, well, we're going to have dog. So that was interesting. Actually, it wasn't that bad. It was pretty good. But, you know, if you get around the fact that it's a dog.
So what does this have to do with your teeth?
I was eating it and I bit a bone that was hidden.
Okay.
And I chipped my tooth.
So you broke part of your tooth.
Yeah, like half of it, which I had already chipped before. So I had to go to the dentist. And so the dentist created a new crown with, not with gold or porcelain, actually with a paste.
Oh.
And then it becomes hard and it just looks normal. It doesn't even look like I have a fake crown, so to say.
But dentists can be really expensive. So how much did this cost?
Well, this was for the bargain price of $10.
$10.
$10. That's how much it cost.
So we should all go to Cambodia for dentistry.
Yeah, because actually it was pretty good. He looked really young, though. I was kind of scared because when he walked in, he looked like he was 19. But I asked him his age, and he was like 30.
Okay, well, you're very trusting.
Dentists and oral health. A dentist is a healthcare professional who specializes in diagnosing, preventing, and treating problems related to the teeth, gums, and mouth. They help people maintain good oral hygiene and prevent serious health conditions that can result from poor dental care. Regular visits to the dentist are important for overall well-being, as oral health is closely connected to general health. Some of the key reasons why dentists are important. Dentists play a crucial role in keeping people's mouths healthy. Without proper dental care, many problems can arise, such as cavities, gum disease, and even infections that affect the rest of the body. Some key reasons why dentists are important include preventing tooth decay. Dentists help protect teeth from cavities by providing professional cleanings, fluoride treatments, and advice on proper oral hygiene. Treating gum disease. Gum disease can lead to tooth loss if untreated. Dentists check for early signs of gum problems and provide treatments to keep gums healthy. Fixing broken or damaged teeth. Accidents or decay can cause teeth to break. Dentists repair or replace damaged teeth to restore function and appearance. Improving smiles. Cosmetic dentistry, such as teeth whitening and braces, helps people feel confident about their smiles. Checking for serious conditions. Dentists examine the mouth for signs of oral cancer, infections, or other health problems that could become serious if left untreated. What happens during a visit to the dentist? Many people feel nervous before visiting a dentist, but understanding the process can help reduce anxiety. A regular dental checkup usually includes the following steps. Examination. The dentist checks the teeth, gums, and mouth for signs of decay, gum disease, or other issues. X-rays. If needed, the dentist takes X-ray images to look for hidden cavities, infections, or problems with the jawbone. Cleaning. A dental hygienist removes plaque and tartar from the teeth to prevent cavities and gum disease. Fluoride treatment. Some dentists apply fluoride to strengthen teeth and prevent decay. Advice on oral hygiene. The dentist gives recommendations on brushing, flossing, and diet to keep teeth healthy. Regular dental visits help detect problems early and prevent serious issues. Most checkups are painless, and modern dentistry ensures that treatments are as comfortable as possible. Common dental problems. Dental issues are common, but with proper care. Many of them can be prevented or treated early. Some of the most frequent dental problems include cavities, tooth decay, caused by bacteria that produce acids. Cavities create holes in teeth that need fillings. Gum disease, gingivitis, and periodontitis. Inflammation of the gums can lead to bleeding, swelling, and even tooth loss if untreated. Tooth sensitivity. Some people experience pain when eating hot, cold, or sweet foods due to worn-down enamel or exposed nerves. Bad breath, halitosis, poor oral hygiene, infections, or diet can cause persistent bad breath. Wisdom teeth problems. Some people experience pain or infections when their wisdom teeth do not grow properly. Crooked or misaligned teeth. Many people require braces or aligners to straighten their teeth for better function and appearance. How to take care of teeth. Maintaining good oral hygiene is essential for preventing dental problems. Here are some key ways to keep teeth and gums healthy. Brushing twice a day. Use a fluoride toothpaste and a soft bristle toothbrush to clean teeth thoroughly. Flossing daily. Flossing removes food and plaque from between the teeth, preventing cavities and gum disease. Eating a healthy diet. Avoid sugary foods and drinks, and eat foods rich in calcium, such as dairy products, leafy greens, and nuts. Drinking water. Water helps rinse away food particles and keeps the mouth hydrated. Avoiding smoking and alcohol. Smoking and excessive alcohol consumption can lead to gum disease, bad breath, and oral cancer. Visiting the dentist regularly. Checkups every 6 months help catch problems early and keep teeth in the best condition. Types of dentists. Not all dentists perform the same treatments. Some specialize in specific areas of dental care. Different types of dentists include general dentists. These are the most common dentists who provide cleanings, fillings, and preventive care. Pediatric dentists. Specializing in children's dental care, they help kids develop good oral hygiene habits. Orthodontists. They fix misaligned teeth and jaws using braces or clear aligners. Periodontists. experts in treating gum disease and other conditions affecting the gums and bones supporting teeth. Endodontists. They specialize in treating the inside of the tooth, such as root canals. Prosthodontists. They restore and replace missing teeth with dentures, bridges, or implants. Oral surgeons. They perform surgeries such as wisdom tooth removal, jaw correction, and treating facial injuries. Dental tools and equipment. Dentists use various tools to examine, clean, and treat teeth. Some of the most common dental tools include mirror, helps the dentist see inside the mouth and check hard to reach areas. Explorer, dental probe, used to check for cavities and other issues on the surface of the teeth. Scaler, removes plaque and tartar from the teeth. Suction device, removes saliva and water from the mouth during procedures. Drill, used to remove decayed parts of a tooth before filling a cavity. X-ray machine, takes images of the teeth and bones to detect hidden problems. Modern dentistry continues to develop new tools and technology to improve patient comfort and treatment outcomes. The future of dentistry. Dentistry is constantly evolving, with new advancements making treatments faster, safer, and less painful. Some future trends in dentistry include laser dentistry. Lasers are being used for treatments like cavity removal and gum disease treatment, reducing the need for drills. 3D printing. Dentists are now able to create custom dental crowns, bridges, and dentures quickly using 3D printing. Teeth whitening innovations. Safer and more effective whitening treatments are being developed for at-home and professional use. Artificial intelligence, AI, in dentistry. AI helps dentists diagnose problems more accurately and recommend the best treatments. Regenerative dentistry. Scientists are researching ways to regrow damaged tooth enamel or even create bioengineered teeth. Why people fear the dentist. Many people experience anxiety about visiting the dentist. Some common reasons for dental fear include fear of pain. Some people worry that dental treatments will hurt, but modern techniques and anesthesia make most procedures painless. Previous bad experiences. A painful experience in the past can make someone afraid to return to the dentist. Needles and drills. The sight or sound of dental tools can cause anxiety in some people. Loss of control. Lying in a chair while someone works on your teeth can make people feel uncomfortable. To overcome dental fear, patients can talk to their dentist. Dentists can explain the procedure and help patients feel at ease. Use relaxation techniques. Deep breathing and calming music can help reduce anxiety. Choose a gentle dentist. Some dentists specialize in treating nervous patients and can provide a more comfortable experience. Conclusion. Dentists play an essential role in maintaining oral health and preventing serious dental problems. Regular dental checkups, proper oral hygiene, and a healthy diet are crucial for strong teeth and gums. While some people fear going to the dentist, modern advancements have made treatments more comfortable and effective than ever before. By understanding the importance of dental care and making regular visits to the dentist, people can enjoy a healthy smile for life.
The English Pod Audio Review. Listen to the meaning, then say the vocabulary word.
Sit down.
Seat.
Tooth pain.
Toothache.
Some parts are bigger than others due to a certain disease.
Swollen.
One of the 4 large teeth at the back of the mouth, which grows only in one's adulthood.
Wisdom tooth.
Take a glance.
Have a look.
A hole in a tooth.
Cavity.
The part of the tooth which can be seen.
Crown.
Something that fills a hole in a tooth.
Filling.
A medical examination that takes a picture of your bones.
X-rays.
To use a thin thread or string to clean between your teeth.
Floss.
A liquid that is used to clean your mouth and teeth and make your breath smell better.
Mouthwash.
A disease in which the gums become red, swollen, and sore.
Gingivitis.
A thin coating that forms on the teeth and contains bacteria.
Plaque.
Used to describe when someone has very bad breath.
Dog breath. Let's try that faster.
Sit down.
Seat.
Take a glance.
Have a look.
The part of the tooth which can be seen.
Crown.
A thin coating that forms on the teeth and contains bacteria.
Plaque.
Something that fills a hole in a tooth.
Filling.
A liquid that is used to clean your mouth and teeth and make your breath smell better.
Mouthwash.
A disease in which the gums become red, swollen, and sore.
Gingivitis.
One of the 4 large teeth at the back of the mouth, which grows only in one's adulthood.
Wisdom tooth.
Used to describe when someone has very bad breath.
Dog breath.
Some parts are bigger than others due to a certain disease.
Swollen.
To use a thin thread or string to clean between your teeth.
Floss.
A hole in a tooth.
Cavity.
Tooth pain.
Toothache.
A medical examination that takes a picture of your bones.
X-rays. Now say the word and hear it in a sentence. My nose is swollen. It's the size of a football. Put some ice on your foot and the swelling will go down. I got bitten by a spider and my hand is swelling up. John told me that it doesn't look good for me. I probably won't get the job. It doesn't look good for Michael Jackson. He's in a lot of debt. You know, the economy doesn't look very good. I just got my wisdom teeth out, so I can't eat anything. You're going to have to get your wisdom teeth pulled. I think my wisdom teeth are coming in. Cavity. My tooth is really hurting. I think I have a cavity. Cavity. If you don't brush your teeth, you'll get cavities. Cavity. You can see on this X-ray that you have 4 cavities. Have a look. So you're having car trouble. Let's have a look at the engine. Have a look. Let's have a look at your computer and see what the problem is. Have a look. Let me have a look at your report.